Okay, guys, this video is going to be on seizure disorder. So I'm going to get right into it. I am going over my notes from lecture, which is their PowerPoint. All right, so we're going to start with seizure. And again, this is neurological system. Seizure disorder, diaphoresis and incontinence, flushing is something you see in a seizure disorder. Let me read it, what a seizure is. It is a sudden abnormal, this is from my book. Seizure is a sudden abnormal excessive electrical discharge of neurons in the brain. During a seizure, multiple neurons fire at a rate much faster than normal, causing involuntary movements, sensory phenomena, emotional expression, and unusual behaviors. Seizures may accompany a variety of disorders or occur without any apparent cause. A seizure disorder, or epilepsy, is a group of neurological diseases marked by recurring seizures. If a person has 2 or more seizures more than 24 hours apart without an underlying problem that caused the seizure, they may have seizure disorder. All right, if a person has 2 or more seizures more than 24 hours apart without an underlying problem that caused by the seizure, they may have a seizure disorders. Seizures from systemic and metabolic problems are not seizure disorders if they stop with the underlying problem when the underlying problem is corrected. It is the fourth most common neurological disorder. It affects men and women of all ages, races, and ethnic backgrounds. All right, let me go back to my notes. Males are more likely to develop epilepsy than females. In the U.S., 3 million people have seizure disorders. Epilepsy and seizure disorders. Epilepsy is a condition by spontaneous recurring seizures. The seizures are transient, uncontrolled electrical discharge of neurons on the brain, interrupting normal function. They may accompany other disorders or occur spontaneously without apparent cause. I just read that in the book. The etiology and patho for seizure disorder. I just read all this again, but I'm going to read it again. This is from my notes. It's characterized by a group of abnormal neurons undergo spontaneous firing. Firing spreads to adjacent or distant area of the brain. If activity involves whole brain, both hemispheres, generalized seizure occurs. Cause of abnormal firing is unclear. If involve one hemisphere of the brain, it is a focal seizure. If it involves one hemisphere of the brain, it is a focal seizure. And the clinical manifestations, it is determined by the site of the electrical disturbance. It is divided into 3 major classes. You have a generalized, focal, and unknown onsets. They may progress through 4 phases. Know these 4 phases, okay? You have a prodromal phase, which it precedes seizure with sensation or behavioral changes. An aural phase is with sensory warning each time. Ictal phase, which is with full seizures first symptoms and end of seizure activity. And then postical phase is a period of rest and recovery after the seizure. Let me look at the book and get more in-depth stuff from that. These manifestations. Okay, here we go. So let me read what the book says. The system divides seizures into 3 major classes based on where the seizure activity begins. Generalized onset. Okay, that's something else. I'm sorry. That's the next section I'm going to talk about. I was trying to find this information in the book. I'm all in my video. Ew. What is this? The 4 phases. Where does it talk about the 4 phases in the book? I hate whenever the notes are not in order. Like, I wish the teacher would just go in order through the stuff, but anyways, let me not be complaining on here. Let me go. I don't know. Okay, I'm going to keep reading. So again, I have to know this. Look, it's. I did it in red, so I need to know it for the exam. So I'm going to read it one more time. Um, oh, I found it in the book. Okay, so clinical manifestations. Depending on the type, a seizure may occur in 4 phases. One, prodromal phase, which is with sensations or behavior changes that precede a seizure by hours or days. Two is aural phase, with it is with a sensory warning that is similar each time a seizure occurs and is part of the seizure. Three is ictal phase, from first symptoms by the end to the end of seizure activity. And four, postictal phase, the recovery period after the seizure. Not all patients have every phase. Okay, that's good to know. Not all patients have every phase. I need to go back and add this to my notes because this was not in my notes. Okay. General seizures is next. A tonic-clonic seizure, formerly known as grand mal. Don't know why. It's characterized by a loss of consciousness and falling. The body stiffens. Oh, I remember here. T, stiff. Body stiffens, tonic phase, with subsequent jerking of extremities, a conic phase. Cyanosis, excessive salivation, tongue or cheek biting, and incontinence may occur. The postical phase is characterized by muscle soreness, fatigue, and a patient may sleep for hours. May not feel normal for hours to days. No memory of seizure. This is an atonic-clonic seizure. Let me go back and read this from the book. Tonic-clonic seizure, formerly called grand mal. It is the most common generalized onset motor seizure. During a tonic-clonic seizure, the patient loses consciousness and, if upright, falls to the ground. The body stiffens for 10 to 20 seconds and then extremities jerk. This is the clonic phase. They may last to 30 to 40 seconds, up to several minutes. Cyanosis, excess salivation, tongue or cheek biting, and incontinence may occur during the seizure. In the postical phase, the patient usually has muscle soreness, feels tired, and may sleep for several hours. Some patients do not feel normal for several hours or days after a seizure. The patient has no memory of the seizure. This is again, tonic-clonic seizure. All right. The next one, other generalized onset seizures. Generalized onset seizures. Okay, they start over wide areas of both sides of the brain. They are characterized by bilateral synchronous neural discharges. In most cases, the patient has impaired consciousness for a few seconds to several minutes. Generalized seizures are either motor or non-motor. Motor movements are bilateral. Okay, let's see what the notes say. It says other generalized onset seizures. So we have an atonic seizure or drop attack. It involves tonic episode or paroxysmal loss of muscle tone. Begins suddenly and person falls with atonic. Let's just think you're going to hit with the atonic bomb. Boom, you're going to fall. I don't know. Consciousness usually remains. You can resume normal activity immediately. Great risk for head injury, so wear a protective helmet. And then the generalized onset non-motor seizure is a myoclonic absent seizure. That's a word. That's a different. Let me highlight that. Generalized onset for a non-motor seizure. Myoclonic absent seizure. Characterized by rhythmic arm abduction 3 per second. Leads to progressive arm elevation and lasts 10 to 60 seconds. Let me go to that one. Let me read on that one. It says other types of generalized onset motor seizures include tonic and clonic. A tonic seizure involves a sudden onset of increased tone in extensor muscles, contributing to sudden stiff movements. I already read about tonic seizures a minute ago, or I talked about it. Tonic seizures most often occur in sleep and affect both sides of the body. Tonic seizures usually last less than 20 seconds. The patient usually stays aware. Clonic seizures, though, however, begin with the loss of awareness and sudden loss of muscle tone. Clonic seizure, let me highlight this in my book, and tonic seizure. And the clonic seizures begins with loss of awareness and sudden loss of muscle tone, followed by rhythmic limb jerking that may or not be symmetric. A generalized atonic seizure or drop attack involves a brief sudden loss of tone. It may affect just the head and neck or result in the person falling to the ground. Seizures typically last a few seconds. There's a brief loss of consciousness and a brief postical confusion. Can I pause this? No, I'm not going to pause it. Jessica, hold on a minute. Let me finish this section. Okay. So, myoclonic, we're still on that. Patients with a tonic seizure are at great risk for head injury because remember, atomic bomb, you're going to fall, you're going to hurt yourself. They often need protective helmets. All right, so next we're going to talk about the focal onset seizures. Focal onset seizures. I don't know why I don't have this in my notes, but there's also, I'm going back, sorry. There's also absent seizures, which most often occurs in children. Oh, maybe that's how we didn't go over it because we're not doing children yet. All right, focal onset seizures, formerly called partial or partial focal seizures. Formerly called partial or partial focal seizures for the focal onset seizures. Patients remain conscious and alert. They have unusual feelings, aura or warning, or sensations that can take many forms. Sudden and unexplainable feelings of joy, anger, sadness, or nausea. They may hear, smell, taste, see, or feel things that are not real. May report numbness and tingling of arm. Complications. The status of epilepticus, which is a neurological emergency. Okay, so now we're going to complication. I'm guessing of seizures in general. A state of constant seizure or condition when seizures recur in rapid succession without return to conscience between seizures. Most serious complication of epilepsy. Convulsive status epilepticus, most dangerous, can cause ventilatory insufficiency, hypoxemia, and cardiac arrhythmias, and it can be fatal. SUDEP, which is a sudden, unexplainable death in epilepsy. Let me go and read this a little bit more in the complications. People with seizure disorder have a higher mortality rate than with general population. Severe injury or death can result from trauma suffered during a seizure. Patients who lose consciousness during a seizure are at greater risk. Other deaths are due to accidents during seizures, deaths from an underlying disease, sudden unexpected death in epilepsy, or status epilepticus. It is a state of continuous seizure activity. We define SE as a seizure lasting longer than 5 minutes or occurring so close together that the patient cannot recover between them. The longer seizure lasts, the less likely it is to stop without drug therapy. Okay. Convulsive status epilepticus is the most common form. Before that, it said as neurons become exhausted and cease to function, permanent brain damage may result. The goal of therapy is to rapidly end clinical and electrical seizure activity before neuronal damage occurs. Without effective proper treatment, SCE can lead to respiratory insufficiency, hypoxemia, dysrhythmias, and hyperthermia, and systemic acidosis. The prognosis is related to the cause, length of the seizure, patient's age, and time to treatment. Okay. All right, next is the diagnostic studies on this. We need accurate, comprehensive description of the seizures with patient's health history. The time you observation, and you record accurately, okay? That's important. EEG helps determine the type of seizure and helps pinpoint the seizure focus where the seizure, started. Magnetoencephalography, CBC, serum chemistries, liver and kidney function, UA to rule out metabolic disorders, CT or MRI in new onset seizure to rule out structural lesion. That's for diagnostic studies. The most useful diagnostic tool is an accurate, comprehensive description of the seizure and patient's health history. If a patient is diagnosed with seizure disorder, the seizure type must be correctly identified to determine the correct treatment. The EEG is useful if it shows abnormalities. Abnormal findings help determine the type of seizure and pinpoint the seizure focus. An EEG should be done within 24 hours of a suspected seizure. Only a small number of patients with seizure disorder have abnormal EEG findings the first time they have an EEG. Repeated EEGs, continuous EEG monitoring, or video EEG may be needed to detect abnormalities. Magnetoencephalography (MEG) may be done with the EEG. MEG has greater sensitivity in detecting small magnetic fields of neuron activity. A complete blood count, CBC, serum chemistries, liver and kidney function tests, and urinalysis assess for metabolic problems. A CT scan or MRI should be done in any new onset seizure to rule out a structural lesion. If an MRI shows a spot or lesion, but EEG results differ, MEG can see if the brain waves are coming from the lesion. Okay. Next, we're going to go to nursing implementation, health promotion. Promote safety measures, wear helmet if risk for head injury, general health habits, diet, exercise, assess to identify events or situations precipitating seizures, and avoid if possible. There was something else. I need to watch your PowerPoint because I am missing stuff. It says instruct, and then it ends right there. So let me see. Health promotion. Many seizures do not require emergency medical care because they are self-limiting and rarely cause injury. However, if SC or injury occurs, or if the event a first-time seizure, or if the event is a first-time seizure, medical care should be sought immediately. Drug therapy. The main treatment for seizure disorder is anti-seizure drugs. Because a cure is not possible, the goal of therapy is to prevent seizures with minimal drug side effects. Most drugs stabilize nerve cell membranes and prevent spread of the epileptical discharge. Therapy should begin with a single drug based on the patient's age, weight, and type, frequency, and cause of seizure. Dosage should be increased until seizures are under control or toxic side effects occur. Anti-seizure drugs successfully control seizures for about 70% of patients. The other 30% do not respond to anti-seizure drugs. They have medically refractory epilepsy, drug-resistant epilepsy. Oh. Our goal is to provide the best control with the least amount of medication. Each drug has a therapeutic range. Above the range, the most patients have toxic side effects, and below the range, most continue to have seizures, like that phenytoin, right? Let's see. The main drug to treat tonic-clonic and focal onset seizures are phenytoin, carbamazepine, Tegretol, and divalproex, Depakote. These drugs used most often to treat generalized. Ooh, that sun is bright. It's so nice. Sorry. The main drugs to treat tonic-clonic and focal onset seizures are phenytoin, carbamazepine, Tegretol, and divalproex, which is Depakote. These drugs used most often to treat generalized onset non-motor and myoclonic seizures include Zerontin and Clonazepam. Treatments for focal seizures are carbamazepine and lamotrigine or Keppra. Some drugs are effective for multiple seizure types. Okay, so know your drugs for these seizures. Okay. The next section is on multiple sclerosis. So I'm not going to get into that yet. Where is it? Where's multiple sclerosis in the book? What? Oh, okay. This skips next to, the next part in the book is actually restless leg syndrome and multiple sclerosis. So I'm going to stop the video because we just did seizures right now. So seizure disorder. So I don't want to record the next section on this video. So this video is it's 19 minutes long. I hope you learned something from it. That was all that I had in my notes, and I tried to read some information out of the book as well. Let me end the video, and we will start on multiple sclerosis next. Thank you. Like, subscribe. and merch coming soon. Send me some free gifts if y'all want. I'm just, I can wear a t-shirt, promote your business, or whatever.